Hi, my name is Dr. Samara Rashid, and today we will be talking about chemical and waste management. And chemical and waste management can be found in Chapter 23 in the textbook Modern Dental Assisting from 13th edition by authors Bird and Robinson. Hazardous chemicals are considered any chemical that can cause a physical hazard or a health hazard. A chemical is hazardous if it ignites, is reactive, is corrosive, or is even toxic. So ignite, as the word it says, is just basically it can catch flame. It's combustible, and reactive is if it explodes when it's mixed with other substances. It could also be corrosive or highly acidic or basic, and it could be toxic or poisonous. You'll see on the lower right in figure 23-1, it came directly from the textbook, and oftentimes you'll see some labeling that's done on many products indicating whether the product is flammable or toxic or any type of hazard in a dental setting. Okay, there's three primary methods of chemical exposure. One is inhalation. Okay, that's direct damage to the lungs, and from the lungs we all know that such chemicals can then go into our blood, and then from our blood it can cause organ damage. The skin contact as well is another primary method of chemical exposure. Direct skin contact must occur. A repeated contact could be something, it can cause something like dermatitis. And ingesting the actual chemical or swallowing it can actually be a primary method of such an exposure, like eating lunch in a contaminated area can cause someone to ingest a specific type of chemical. And the little figure on the bottom has come directly from your textbook. Acute and chronic chemical toxicity. There's different types of toxicities. Acute is more short term and chronic is more long term. Acute chemical toxicity is usually from high levels of exposure in just a short period of time, usually from a chemical spill. The effects are felt immediately, and such symptoms like dizziness, fainting, and vomiting could occur. Acute symptoms may arise due to acute exposure. Chronic chemical toxicity is from many repeated exposures to lower levels over a much longer period of time, like months or years. And therefore, such exposures can lead to something like liver disease, cancer, infertility, and so, the problems are more dynamic. Safety data sheets, or SDS, we talked a little bit about this in previous chapters, but they're accompanied with products in use. They must be checked before each use, and they give you basic instruction and tell you how to handle the chemical and how or where to store it. These safety data sheets have replaced the term material safety data sheets, and before we used to call them the MSDS sheets, but now we just call them the SDS sheets. As the name shows, acute exposure is more of a single exposure to high concentration of a chemical, again, leading to something like dizziness or dermatitis from direct skin contact. Chronic exposure, long-term daily exposure to low levels of a chemical, and that can lead to something like leukemia and cancer. Hand protection. Chemical use has to be dealt with on the daily in a dental office setting. So, many times a lot of health practitioners or healthcare providers think they can just use gloves, where you can't just use plain and simple latex gloves, because a lot of these chemicals that we're using can actually go through those type of latex gloves. You want something more durable. So chemical use must be dealt with while using utility gloves, and they're made from chemical resistant materials. For example, the industrial grade nitrile gloves that you see here pictured in the figure to the right. Latex gloves degrade, and they can actually cause skin exposure. Eye protection. Eyes must be protected from fumes and splashes while pouring chemicals like X-ray processing solutions. Safety eyewear has to be worn at all times. Ideal goggles have soft vinyl rims at the top and bottom, and they fit the face snugly, just like you see here in the picture to the right. Protective clothing. When mixing or pouring chemicals that are staining or caustic, it is best to wear a rubber apron. Personal protective equipment or PPE must be worn at all times. Masks, this deals with the inhalation protection. It may or may not provide adequate protection when working with chemicals. It must be fluid repellent. It must provide respiratory protection. And it might need a mist respirator face mask that's approved by the NIOSH. A special ventilation system for chemicals used in the dental office may be necessary in rooms that utilize them, laboratory, the dark room, and even the sterilization area. You'll see the classic duckbill mask to the right in the figure 23-4. Disposable respirator has tapered angle to fit the facial contours around the nose and chin to protect against dust and chemical mists. Of course, there are different grades of these masks, and you'll hear that there's quite a number of masks that offer different kinds of protection. We always have to be prepared for an emergency. So in the case of a control of chemical spills, you want to refer to the safety data sheets or labeling of the specific product when you're managing your spills. We have something called the mercury spill kits, and that has to be available in all dental offices. Again, it's recommended to use these kits with utility gloves or even just chemical spills overall. You'll see to the right in figure 23-5, there's a mercury spill kit with an aspirator to pick up any large drops of mercury. Labeled bottle for recovery mercury is present there. You also have a base or activator product to help absorb the small amounts of mercury. Okay, and of course you see your basics like your gloves, the scoop, the sponge, mixing cups, spatulas, and labeled polyethylene bag for disposal. As you'll notice in the clinic and even in the dental skills lab, you'll have something called eye wash station pictured in 23-6 to the right. OSHA requires them to be installed in every workplace where chemicals are used. And of course, there's a variety of styles. They must be inspected, recorded, and maintained monthly. And then you'll see in the skills lab, as well as in the dental clinic, that there are log sheets present or posted nearby with signatures indicated that these eye wash stations have been inspected. Ventilation. It's necessary when you're dealing with any type of chemical that there be proper ventilation. Many dental offices are equipped with special exhaust systems for fumes and dust in the lab, sterilization areas, and darkroom areas. We want to make sure that we're not inhaling all those chemicals. We want to make sure there's proper ventilation to minimize as much as we can any type of inhalation products or droplets that can enter our system. General precautions for storing chemicals. There must be careful use and storage, ensuring preparations that they retain their effectiveness. Basic safe policy for storage must be adequate. It should keep them in a dry, cool, dark place where they are not exposed to direct sunlight, because there oftentimes these chemicals are deteriorated by light. And you'll see to the right, there's guidelines for minimizing exposure to chemical hazards in the dental office. Okay, this is taken directly from your textbook in chapter 23. The disposal of empty containers. Empty containers can be hazardous. They often hold residues that can burn or even explode. You should never ever fill an empty container with another substance, because if you do, there is a possibility that even that small amount of chemical that's present in that body can cause a chemical reaction. Always follow the instructions on the label and the safety data sheets regarding how to dispose. Hazardous waste disposal. Substances are considered hazardous waste if they have certain properties or contain chemicals that can pose dangers to human health and the environment after they are discarded. Wastes are classified as hazardous if they have these following characteristics that were mentioned previously in the chapter. If they're ignitable, meaning if they're flammable or combustible, if they're corrosive, like if they're acidic, if they're reactive, like they're unstable or explosive, or even if they're toxic, and they can be considered as pesticides. Okay, they are listed by the Environmental Protection Agency or the EPA. The Hazard Communication Program, otherwise abbreviated as the HCS, is basically the Employee Right to Know law. Employers must inform employees about the identity and hazards of all chemicals exposed to in the workplace. It's issued by OSHA in 1983. In 2012, OSHA revised the HCS and adopted the globally harmonized system of classification and labeling of chemicals, otherwise known as the GHS. Upon revision of the HCS, it was noted that each chemical will be classified and labeled this same regardless of where in the global market the chemical is made or used. Employers will still be required to have a written program with the same components and provide training and identify hazards by using labels and the SDS. The globally harmonized system of classification and labeling of chemicals has changed the way chemical hazards are now identified and the way the information is communicated by standardized information on the labels and SDS. New standards will now improve the quality and the consistency of information available to employees using these chemicals in the workplace. So it's really, really important that everybody know what's in the bottle and how is it hazardous to me, what I should do to prevent any type of hazard or any type of negative conflict that could occur if I were to handle the chemical. There's three major areas of change to the HCS. There's a hazard classification, there's labels, and dealing with the SDS itself. With the hazard classification, chemicals are classified into categories that compare hazard severity within a hazard class. It helps to ensure that evaluations of the hazardous effects are consistent for all manufacturers and that labels and SDS are also consistent. The labels must now have a signal word or even a pictogram and a hazard statement for each hazard class and category. The SDS must now have a specified 16-section format. Employers are required to train the workers on new label elements and SDSs by June 1st, 2016. So as of 2016, employers are now required to provide staff training on label elements for identified physical or health hazards. There's also a phase-in period, and that's a time frame where previous labels and MSDSs will be used in the workplace, as well as new GHS pictograms and SDSs are used. So it's not like an abrupt change. There is this phase-in period where we do have to do the transition with the labeling and, with the pictogram. So when dealing with these three major areas that I mentioned above, there is a phase-in period that we can go ahead and make those changes. Okay. You'll see this in figure 23-8 in your textbook. Okay, and this just basically shows the OSHA labeling. Okay, and there's a sample label to the right in the little box there. Now in this box, you'll see that, it asks for the product identifier, the supplier identification, the pictograms that I mentioned, and also the precautionary statements here, like what to do if something were to happen, first aid, for example. So this is kind of like a template to follow. So, you should go ahead and make friends with it because it's important that once you go out to your rotations or even to any practice that you decide to work at, in your careers, that you are kind of familiar with what you're dealing with or where to look for or what product to look for on a labeling. Your book mentions a written program, and the written program must identify all employers who are to be exposed to the hazardous chemicals and the person who is responsible for the program. A written program must describe staff training, how the chemicals are handled in the office, and how to respond to chemical emergencies. All the employers must be aware of hazards and protective measures so that they can train their employees. This will also help to prepare everyone in case if something were to happen in the office and there was an exposure. For example, you'll learn about a chemical called formicrysol when doing a root canal on a patient. Formicrysol can kind of burn when it's exposed to your hands or anything like that. So if there's a spill of some sort, the SDS or even the written program will tell you how to handle the spill. Okay, a little bit of a written program in terms of the responsibilities of the dental assistant as coordinator of the hazard communication program. First foremost, it's very important to read and understand the standard. Then you have to implement it, and then compile a list of the products in the office that could be hazardous and obtain the SDSs. It's important to keep the SDS file updated with any new products that are added in the inventory, and also to inform other employees of the location of the SDSs. Labeling appropriate containers is also very, very important, just like we discussed in the previous slide. And there also has to be training that's implemented for employee to employee. Okay, a chemical inventory is a list of all products used in the office that contain chemicals. Each time a new product that contains a chemical is brought into the office, it has to be immediately added to the chemical inventory. So therefore, there should be an SDS file on it, and if that takes place, then I'm sure there's binders in these private practices or clinics that contain an SDS file, so that needs to be updated. The dental assistant often takes responsibility for maintaining the file and the chemical inventory. The SDS sheets contain health and safety information about every chemical in the office. The manufacturer of a product that contains chemicals is required to supply the dental office with an SDS for the product. The dental office must make sure that SDS is available for every chemical used in the office. Okay, it's often placed in a package with the product, and it should be organized in binders like I mentioned in the previous slide, so that employees have ready access to them and can easily locate a particular sheet. It also allows for better organization overall. Okay, your book mentions a little bit about the safety data sheets in table 23-1 and the sections of hazard communication. Okay, so you'll see here the fact that the HCS requires the chemical manufacturers and distributors, and you'll see the section, you'll see the description, and the actual explanation of them. So this keeps it in a more organized fashion. Okay, your book also has a little feature of a box 23-1. Okay, and this is the required format of the safety data sheets. It'll break it down into sections in terms of the ID, the hazard, the stability, the transport, how to transport the information, the regulatory information. Employee training is essential for a successful hazard communication program. The staff training is also required for many reasons. When a new employee is hired, you have to have staff training. When a new chemical product is introduced, you got to have training. And of course, once a year for updates for all continuing employees. There has to be records of these training sessions, and they have to be kept on file for at least 5 years. A dental assistant may assist in the training of new employees and could be responsible for routinely following safety precautions. So chemical training programs for employees must provide information on the following. So when you have a training, for example, for employee to employee, for example, where you go out and work, you have to learn how to safely use the chemicals and understanding the information on the SDS. All the safety practices included on the warnings and how to use the required PPE. And overall, you definitely have to know how to have safe handling and disposal methods. Okay, your book has a little bit of a guide box for hazard communication employee the training program, and in terms of its requirements, the written communication, understanding of the hazards, and overall just a summary of what we talked about. Okay, the labeling of chemical containers. Containers have to be labeled to indicate what chemicals they contain and any hazards that they may be associated with. They have to be, all labels are required to have the pictograms like we mentioned, a signal word, a hazard statement, a precautionary statement, the product identifier, and the supplier. OSHA has not changed the general requirements for workplace labeling. It's important that employees have the information immediately available. Again, I cannot stress enough the reason why it has to be immediately available in case something hazardous happens, or if there's an emergency. Employees must be informed about where to obtain that information within the office. When the chemical is transferred to a different container, the secondary container also must be labeled. An example is when a concentrated chemical disinfectant is mixed with is mixed fresh and is placed into a spray bottle or a tub, which is considered the secondary container. The spray bottle or tub has to be labeled. So, according to OSHA, the secondary container must have on its label the product identifier in words, pictures, symbols, or combination thereof, which provide at least general information regarding the hazards of the chemicals, and which, in conjunction with the other information immediately available to employees under the Hazard Communication Program, will provide employees with the specific information regarding the physical and health hazards of the hazardous chemical. This statement is very lengthy, but it comes directly, from OSHA, and it's in quotation. So it's just important that you just know that OSHA directly says this detailed information, and it also puts in summary of everything we just talked about. Okay, so this could be labeling of the chemical containers, like an example of it here. Like this is like a template you can follow again. This can be a sticker. It could be found on any of the bottles that you work with. So you could see here the product identifier, the pictograms, okay, the color, the signal word, okay? And also, I think your book has a picture of a bottle with this on it. It's important that this be filled out. Again, we're still talking about labeling of the chemical containers, and there are certain regulations or rules to follow when transferring a substance or liquid from one container to another. Again, many chemical containers should not be rinsed out with water because they react violently when mixed with this substance. The National Fire Protection Association labels, otherwise abbreviated as the NFPA, it involves the use of 4 diamonds: blue, which is for health hazard, red for flammability, yellow for reactivity, and white for special hazard symbols. The diamonds are filled with numeric readings from 0 to 4, with 4 being the most hazardous. And you'll see to the right, there is a procedure 23-1 in creating an appropriate label for a secondary container. So the goal is to create a label for the secondary container according to the OSHA standards, okay? And it talks a little bit about the equipment and supplies and actually the steps for creating the appropriate label. So please always keep in mind, the whole template and the procedural steps when you're creating the secondary container. Okay, some exemptions to labeling requirements. Some examples could be like tobacco products, wood products, food, drugs, cosmetics, alcoholic beverages. Other examples from exemptions from these labelings are drugs dispensed by a pharmacy to a healthcare provider for direct administration to a patient. Other examples are over-the-counter drugs and drugs intended for personal consumption by employees while in the workplace, such as aspirin and first aid supplies. Okay, in table 23-2, you'll see how they talk about dental office waste management. And there's types of dental waste. In the category to the left, you'll see there's medical waste, contaminated waste, infectious waste, general waste, toxic waste. Okay. Here to the right, you'll see the definition. So for example, medical waste is waste generated as part of the treatment. It can be contaminated or infectious. Examples are contaminated barriers. Okay. Another important one I wanted everyone to know was chemical waste. Waste that poses a threat to humans or the environment, believe it or not, even extracted teeth fall under this category. So it's really important to consider that extracted teeth poses as a chemical waste. Okay, needles and burrs, those are considered hazardous waste. Okay, because it usually refers to toxic chemicals or materials. Scrap amalgam or the silver metal fillings that we get sometimes, that's considered toxic waste. So go ahead and review this table 23-2 and make friends with it, just so you get to know, because this will follow you everywhere you go, especially when breaking down a unit after a patient has been dismissed after treatment. Okay, dental office waste management. An environmental impact is minimized when regulated materials or waste are handled or recycled, treated, or disposed of properly. I think we talked about the radiographic solutions like the fixer and developer, what could be dumped down the sink, what can't, and having an outside service that would take some of those solutions away. So traditionally, in the past, well, even in the present, when we take radiographs, we could do them the traditional way where we take an x-ray, expose it, take the film, and when we're dealing with a film, we go into a dark room and we have that developed in a processing machine. In the machine, they consist of the developing solution or the fixer solution, but there's a way to dispose of the fixer solution. You can't just dump it down the sink. So if you dump it down the sink, you can actually have an environmental impact. You want to have it disposed of properly. So regulations vary from state to state, and many states require dental offices to have specific types of waste hauled away by a licensed carrier. The dental assistant should know the types of dental waste, how to comply with the regulation, and ways to minimize the costs associated with that disposal. Dental office waste management. Dental materials that may be regulated could be found in the bullet points below, and this is taken from your book as well. Mercury, definitely, you'll see that the mercury and dental amalgam, the silver fillings, once they come out of the patient's teeth, if they are enough to be picked up or enough to be like in crumbs form, they must be disposed of in a proper airtight container, such that we're not us workers are not exposed to the amalgam vapors and the mercury vapors. Um, there's materials that have to be regulated in the sense of the lead foil and the shields. So the lead foils and shields, we're dealing with traditional x-rays. Oftentimes when you use the traditional x-ray film in dental offices, if you run into that, the actual film, when you go into the dark room, you'll feel for the film, you'll open it up in the dark room and you'll see this shiny material. It's called a lead foil, and that cannot just be simply thrown away. It has to be in a proper container or box, and that has to be thrown away in a particular type of way. Again, X-ray fixer solution and developer solution. Fixer solution is the big one that I know you cannot just dump that down the drain. Okay. Classification of waste. OSHA regulations apply to the handling of waste in the dental office for their protection of employees. When waste leaves the dental office, the EPA regulations apply to the disposal. All dental waste should be classified according to these EPA guidelines that are regulated and non-regulated. So regulated waste includes sharps, like the needles. Other regulated waste could be like blood, human tissue, blood-soaked items, and they require special handling, neutralization, and disposal. Non-regulated waste includes contaminated waste such as saliva slope gauze, bibs, surface barriers. I mean, those aren't really a big deal. Those can be disposed of in irregular garbage. Toxic waste is waste that can have a poisonous effect. Classification of waste. All waste containers that hold potentially infectious materials, whether regulated or non-regulated, must be labeled with the biohazard symbol. OSHA requires this label to protect the employees and the EPA, and it's required by the EPA that this label be present to inform the public. I know oftentimes, I was a dental assistant before I became a dentist, and it was very tedious when you transferred one container to another, and then the labeling, and then the signatures and initials, and then the binders. But, really it's to protect us employees, because, hopefully nothing ever happens where there's a huge spill on our legs or on our arms or anything like that, even like soaking through our clothing material. But it's really to protect us. And it may seem very difficult, but it's to protect us, to protect the public as well as the employer. Extracted teeth, okay, is considered to be potentially infectious materials, and so they're considered regulated waste if they are not disinfected, and they're also returned to the patient. Many states allow the dental office to sterilize the extracted teeth. Extracted teeth that contain amalgam restorations should never be heat sterilized. because the high temperatures from the sterilizer can actually cause those vapors or toxic mercury vapors, and then staff inhales them. Teeth, teeth with amalgam restorations have to be immersed in a solution called glutaraldehyde for at least 30 minutes for disinfection. After the tooth is rinsed, it can be disposed of according to the regulations. Scrap amalgam, again, like I mentioned before, should be stored in an airtight container. Sharps, and you'll see to the right, you'll see a infectious waste biohazard bag, but in addition, you'll see a sharps container here, and you'll see it's you can't really puncture it. It's a hard gallon-like looking figure here. So OSHA, the CDC, and the EPA classifies sharps as infectious waste. According to OSHA, disposable sharps must be placed in a closable, leak-proof, puncture-resistant container immediately after use. You can't just take the sharps, the needles, and just throw them in a bag. Someone will get hurt if you just throw them in a bag. A container like this, here to the right, must be labeled with the biohazard symbol and has to be color-coded. State regulations may differ regarding how frequently the sharp containers must be picked. And you'll notice that in the the containers here, there is a maximum line that has to be that could be reached before disposal of the container. And oftentimes we'll keep dumping the needles into this container, and you'll see that it'll start getting filled up as soon as it reaches a specific line. And I think, if I'm not mistaken, it's on this dotted line at the top of this container. And if it reaches that point, immediately this has to be shut with the lid, and a new container must be used. And then, of course, you have to call the proper place to have a come and do a pickup of this disposal waste management. The scrap amalgam should be collected and stored in a designated dry, airtight container. It's not recycled, and it must be managed as hazardous waste. The container has to be labeled with the name, address, and telephone number of the office and the date on which you first started collecting the material. You must check with the mercury recycling company for any additional requirements. If you find mercury stored in liquid, don't pour the liquid down the drain under any circumstances. Contact mercury recyclers or a hazardous waste hauler for more information. Photochemical waste, we talked a little bit about this before. You'll see to the right, those are the radiographic solutions in holding containers. And this is more for your traditional film type radiographic procedures. Two separate types of waste from the X-ray processing that's done from traditional X-ray methods. You have a radiographic fixer and the radiographic developer. The radiographic fixer is a hazardous waste because of the high silver content that it contains, and it can have on-site you can have on-site treatment and off-site treatment of the radiographic fixer solution. The radiographic developer is likely to be considered hazardous waste and must be managed according to local regulations due to its pH. I believe back many years ago in a couple of other states, the developer was allowed to be dumped down the sink. So, I mean, you do have to call your local, your local waste management organization to see how to handle the developer. But the fixer can by no means ever be dumped down the sink because of its high silver content. Lead contamination, we talked a little bit about the lead foil. And they come from X-ray film packages that are exposed in the darkroom. They're easily recyclable, but they cannot be disposed in the garbage. They're exempt from regulation as a hazardous waste when recycled as a scrap metal. They have to be recycled through a licensed recovery facility. An example of a facility could be like Eastman Coating. Disinfectants, germicidal solutions that contain 2% or less glutaraldehyde, and they usually are poured down the drain. But if germicidal solutions with more than 2% glutaraldehyde are contained in it, they have to be managed as a hazardous waste. So again, you have to check with your local authorities when dealing with that hazardous waste. In regards to the glutaraldehyde, again, you have to look up the SDS, the ingredients, everything that's in that chemical to see if it has 2% glutaraldehyde, more or less of it. It's used, disinfectants are used or unused disinfectants with high concentration of formaldehyde or a flash point less than 140 degrees Fahrenheit is considered hazardous waste and cannot be discharged in the sewer. A flash point is basically a term used where when the lowest temperature at which a liquid gives off enough vapors to form an ignitable mixture with air. Okay, so it's the lowest temperature that can give off the vapors. So if you have a flash point of less than 140 degrees Fahrenheit, it can't be discharged in the sewer. A red flammable label has flash points lower than 100 degrees Fahrenheit. Okay, and that's when the labeling comes into effect. So you have to always check your SDS for the flash points of other materials. Okay, your book talks a little bit about non-hazardous waste management. Regular dental office waste should be recycled whenever possible with respect to the appropriate collection service. Examples are, of course, there are more, aluminum, glass, newspaper, office paper, mixed paper. Okay, the EPA enforces the disposal of regulated waste. The dentist is responsible for proper packaging, labeling, transportation, and ultimate disposal of waste generated in the dental office. All containers should be rigid, leak resistant, impervious to moisture, and strong enough to prevent damage and leakage during handling. I mean, we don't want a container where when they're being picked up or handled by the company or even you to, leak all over the place or, or even the person handling it to get hurt. All containers must be labeled according to the state law, and the dentist is always responsible for the waste until it is rendered non-hazardous or is even destroyed. Many dental offices use a licensed transporter or a disposal source. So what are your takeaways? So the takeaways, if you are ever in doubt about the safety of a chemical product, read the SDS, ask the dentist, or contact the manufacturer. Most of the time, the SDS answers all the questions. But, of course, you do have other resources. No one can, of course, anticipate or predict or prevent every health and safety risk. The risks are greatly reduced when all the dental office personnel are aware of chemical safety and infectious waste guidelines. Like, don't take it lightly. And no one in the offices should take it lightly because if something goes wrong, now everyone's panicking. So it's important to take these things very seriously. You might become the hazard communication coordinator in your office. So wherever you go, you may be in charge of all these things. Therefore, you must stay current with the increasing number and complexity of products in the dental office. So, I know I go through all this and it looks very difficult, but, I've been doing it for many years. But, once you go out and practice and once you get the hang of things, it actually becomes pretty easy. Again, my references are from the 13th edition of the Bird and Robinson textbook, Modern Dental Assisting, and also www.osha.gov. Thank you.